I provide because there are fewer and fewer people who are willing to do this.
It just feels really rewarding, you know, that you're doing something that's really important.
I feel like if I'm not providing, then I don't know who will, especially in Texas.
Women need something, and they want to be able to have control, and I'm a doctor and I can provide it, why wouldn't I?
The deepest compassion that you can have for another person is to respond to them in their time of need.
I came from a really big Irish Catholic background, which was full of amazingly strong women. My older sisters are both very supportive of what I do. It started for me by being mentored at Columbia, and I spent a summer with them, and I was able to be exposed to abortion care, and I was hooked immediately. Here was this woman who needed care. We were able to provide it in a wonderful way, and she was able to get the care that she needed in a way without barriers. It was straightforward medical care, just like everything else, in a loving environment. I thought, I could do this. There's no great story that made me want to do this. There's no spark, there's no magic thing. It just all made sense to me. I provide because if women need it, I should provide it.
Abortion care is a part of equality and justice. And it's not the only answer to equality or justice, but it's a piece of it, and it's an important piece. And I think as a physician that I can help fulfill. And those are things that I hold close. When I was in med school and decided that I wanted to be a family medicine doctor and provide abortions, there was nowhere in Texas that I could get trained. So I came to Albert Einstein, which is where my mentor was, and just the place where the way medicine was practiced was the way I wanted to practice. And I knew that if I left Texas, it's going to be tempting to sort of stay in my little bubble where medicine is practiced the way I want to, but then nothing would change in Texas. And so I said, I have to come back. I have to come back. I have to train other med students and other residents. There has to be somebody who's carrying the torch in a way. I've never come to the resolution that I don't want to do this. It's always been, I have to do this. I want to do this. And I'm happy doing this too.
I was pro-life as a teenager, got to college, started to learn more about the issues, then went on to medical school and found out there for Med Students for Choice that there actually weren't providers. And I thought, well, women can't access this care, and that's silly. I mean, it's a hard enough decision whether or not to stay pregnant, but there's no actual doctors to go to. Across the country, individual states have gotten more and more restricted over time, putting up more and more barriers to women accessing this care, and they've come at it from every angle. The clinics themselves, the people who are providing the services, waiting periods for the women, counseling, ultrasound restrictions, medication abortion restrictions, really anything that they can think of to try to limit access. I mean, the women have to go through a lot, but as providers, you know, we're there to see the women and we're doing what we have to do. I mean, what I go through as a provider is nothing compared to what the women are going through. I provide abortion care because it's a medically uncomplicated and simple procedure that can really make a difference in somebody's life.
I wanted to provide in a place where I could do my best possible work and I wasn't constantly butting my head up against the wall. Where I was working with people who shared my sense of mission and purpose, who shared my concern for these patients and my desire to give them the best possible care in the most compassionate way. The decision about when and whether to have a child is one of the most important decisions a woman can make in her lifetime. The impact is deep and far-reaching. It can affect who she loves, where she lives, does she finish school, how much money does she earn, does she get a job, can she take care of the ones that she already has, and also it can affect things that she isn't making decisions about, like her health. So for me as a gynecologist, if a woman is faced with an unwanted pregnancy and she wants help with that, I feel like it is my duty to help her. But it's more than a duty, it's also a privilege and an honor to be part of her life while I help her move on to the next stage. I became a provider of abortions because when I was 19 and had an unwanted pregnancy, someone provided one to me.
Someone once said, when you wrestle with your conscience and you lose, you actually win. I had to reconcile what it meant to be a women's health provider and to hold my religious understanding with sincerity and integrity. I recently relocated to my hometown of Birmingham, Alabama. The decision to do so was to regionalize the work that I do. Women of color and poor women are more likely to have unplanned, unwanted pregnancies and to need this care. And women drive for hours to make it to the clinic. They come through throngs of protesters harassing them, yelling at them, telling them that they're bad women, that they're killing babies. If they can go through all of that to get there, to access this care, I just want to make sure that there's somebody there to provide it. For me, I became uncomfortable not providing abortions when I know what women face.